Good evening, everyone. On behalf of Alpha Kappa Alpha Sorority Incorporated, Alpha Alpha Omega Chapter of Pittsburgh, we'd like to welcome you to the Breast Cancer Q&A Symposium. Today, we will discuss coping with breast cancer in a COVID-19 pandemic. I would like to introduce my panel of experts here today. We have Dr. Stephen Evans. He is a clinical professor of oncology surgery at UPMC. We also have Yolanda Murphy. She is a speaker, survivor, and also an advocate of breast cancer. Jada L. Pinnell. She is the National Certified Counselor and Board Certified Tele-Mental Specialist. And last but not least, we have Dr. Anita Edwards. She is the Medical Director of Gateway Health and also a member of Alpha Kappa Alpha Sorority Incorporated, AAO chapter of Pittsburgh. Welcome, everyone. Dr. Evans, would you like to elaborate on the Gateway Health and give us a little bit more information in regards to Gateway Health before we get started?
Well, good evening, everyone, and thank you, Tiana and AKA of Pittsburgh for giving us the opportunity to just have this real conversation. I am, of course, as you said, a clinical professor of surgery at the University of Pittsburgh Hillman Cancer Center, and also a proud member of the Gateway Medical Society, which is Pittsburgh's only African-American medical society whose goal and overreaching aim is to help eliminate disparities in our communities of color here in Pittsburgh. And so tonight we are fortunate to just have this wonderful opportunity to explore what we can do together to change how the story ends with breast cancer in African-American women. And I'm looking forward to the conversation. Thank
you, Dr. Evans. Dr. Edwards, would you like to elaborate on the Gateway Health and what that entails?
Well, I also, as Dr. Evans, we're both members of the Gateway Medical Society, so I always want to give out a shout to that organization as part of the National Medical, a component of the National Medical Association, which is, again, as he stated, the organization of African-American physicians who the whole purpose is to try to eliminate disparities. So breast cancer, as we know, is very important to our organization. And then, as you said, I'm also a medical director for Gateway Health, which is in medical insurance, but our new logo is that we are the healthcare that gives the whole care. And so we do dual specialties, we do low income, we do Medicare, Medicaid, and our whole thing is that we want to have give care to the whole person. And so it's very important to us about having equity and among healthcare, especially among African Americans.
Absolutely, absolutely. Thank you for sharing that with us this evening. So let's just deep dive into those difficult questions that we know that we don't like to have, with family members, with friends, as it relates to breast cancer, diagnosis, the screening, the treatment. Let's just deep dive into that. Dr. Evans, we're going to start with you first. What are some of the things that we need to know regarding breast cancer screening, treatment, and especially during these unprecedented times dealing with COVID-19? What can you share with us this evening?
He's muted.
First of all, I just want to dispel some of the myths, okay? There is nothing that you as a woman or man can do that causes you to have breast cancer. Breast cancer is the #1 diagnosis in African-American women, and the second and the most common cause of cancer actually worldwide in all women. And so what we want to talk about is what can we do individually to identify cancer early. Early diagnosis leads to a better outcome and prognosis. And just talk about not being afraid to know your own bodies, to be able to have conversation with your primary healthcare provider about finding any abnormality that you're concerned about, because generally there are no symptoms, and we want to find the cancers early enough before symptoms arise. So screening mammograms remain our most sensitive tool to identify breast cancers early, and for African American women, we need to do that earlier than the stated recommendation of age 40, and have that conversation because that's what's going to help save lives.
Okay. And as you spoke about the myths, we have some questions here in regards to the myths. A lot of women have said in the past that mammograms are very painful. They express that, and that, you know, that's keeping them from actually going to get screening. So would anybody like to answer that? How about we have either Dr. Edwards, you can answer that, or Yolanda Murphy, you feel free to jump in and answer that question.
Well, I just would like to say, both as a female, both as a breast cancer survivor, and then as a physician, I'm not going to tell you it can't be painful in the past. It actually has improved. I was saying earlier, I just recently got my last mammogram, and they are now, every time I go, they come out with new equipment. The equipment now, it doesn't squish you like it did before. It was not that long. You know, it wasn't like hold it down on the pedal and push down on it. But I mean, in the past, I can't say that they didn't have to put pressure down on your breast. But, you know, some things I always told women, make sure you avoid caffeine before you go for these mammograms. You know, lots of times women drink a lot of caffeine, and that makes their breasts more tender. Sometimes even taking some Motrin or Advil or Aleve just to help with the discomfort, if that also happened, would also help women get through the discomfort. But it really is not that bad. You know, if women can go through childbirth, they can definitely go through having a mammogram.
Absolutely. Yolanda, would you like to add anything?
Yes. So of course, thank you for having me. I do agree that it can be painful, much like Dr. Edwards was saying. I mean, I'm a 4-year survivor thriver at this point, and things have changed even from the beginning of when I was diagnosed till now. They have different pieces they can put on and take off. And what I have learned, because I do have dense breasts as well, that I do take something before I go, Motrin, something like that, but it's not as bad. I remember hearing growing up, oh my goodness, you know, those mammograms, and oh my gosh, it's horrible. So it can cause some discomfort if I'm honest, but you know, like Dr. Edwards say, I definitely take something beforehand. And let's also take into consideration the other side of that is, wouldn't you rather know than not know? So that's how I think of it every single time. I'm like, okay, this is for your health, this is for your life. So.
Okay. Thank you for sharing that. Dr. Evans, can you just elaborate a little bit more on the dense breast? What does that actually mean? When I've read, as far as the research, goes, that African American women are prone to having dense breasts. Can you elaborate on that? And is that true or not?
Well, as I said, the mammogram is our most sensitive tool for early detection of breast cancer. And since African Americans under age 25 are more commonly diagnosed with breast cancer, during that time of development, their breast is more dense as opposed to fatty for the older women who are 60 and above. And so the mammogram is able to identify abnormalities. The less dense the breast is and the more fatty the breast is. But nowadays we're able to undergo 3D mammography, which helps identify very small tumors. And used, and that 3D study is complemented with an ultrasound, which is another tool to penetrate the breast tissue and identify tumors when they are small.
Okay. Well, thanks for sharing that. Want to
I
move
have a
on.
question real quick, just in regards
Absolutely.
to why is it the age 40 instead of maybe early, as opposed to early 20s to get a mammogram? To anybody an answer?
Generally, my youngest breast cancer patient was 21 when she was diagnosed with breast cancer. And so that is why we say know your breast starting from the day of your menstrual period, and do it frequently so that you know any changes that kind of occur in your breast. So actually, that's why it's important, as you just said, Jada. If you notice something is wrong in your breast, you have that conversation with your doctor so that you can make a plan of action to allay any of your concerns, especially with regard to breast cancer. Because if cancer is diagnosed at an early age and treated even at that early age, you can still have a good outcome. African American women, in addition to having dense breasts, also have a higher incidence of what a subtype of breast cancer called triple negative breast cancer. And in that instance, there are no hormone receptors present on that cancer cell that can be treated with what you might heard of like tamoxifen or Arimidex. These are hormonal therapy that block estrogen, since estrogen is a growth hormone to make cancer cells grow. All a breast cancer cell is a cell that has lost its ability to stop dividing, and growth hormones in that area, being specifically estrogen, allows those cells to continue to divide and divide and divide until a woman is able to feel a mass. But we want to see you way before you are able to feel a mass. I hope that answers your question, Jada.
And also, and Steve,
Yes, yes.
Steve, if I'm correct, I think when you're younger, like you were saying earlier, your breasts are denser. And so sometimes, because the mammogram does have a problem with density, now the 3D has helped a lot, but before, it was not always able to get through that density. So ultrasound helped a lot for younger women, because it was always the question of what, a lot of time doctors would tell women that there was cysts because of their age and being young. And so ultrasounds helped with that also. So.
Okay. Thank you guys so much for that. There's another question as far as if I don't have a family history of breast cancer, can I get breast cancer?
Yolanda, why don't you answer that?
I'm just shaking my head like, yes. So just a little bit of my background. I was adopted when I was a baby. So technically I don't know my family history. But while I was diagnosed, I saw a genetic counselor, and they did the gamut of panels. And because I didn't know anything genetically, they tested like everything. And sure enough, I didn't have any mutations. I had no history, like family genes, anything that connected BRCA, anything like that to it. So me personally, I can attest to it, family history. It can be non-existent, or you can not know. And yes, you can still get breast cancer. I also know I have friends and family who their moms, their aunts, third generations, no one has breast cancer and they're the first one. So yes, you can definitely get it even without family history.
Okay. So it's definitely important. Go ahead, Dr. Evans.
But it's important to know your family history, because if you have a first generation family members, such as your mother, your grandmother, and your maternal or paternal aunts, yes, that puts you at a higher risk of having breast cancer. But like Yolanda said, most breast cancers are sporadic and not associated with a genetic abnormality, which she was mentioning, BRCA1 and BRCA2. And don't forget, men also do get breast cancer. And if a male comes to you you with breast cancer, we definitely have to be concerned about whether he has the BRCA2 abnormality, because also that may confer him to have an increased risk of pancreatic cancer and prostate cancer. And likewise, in women, only less than 5% of women with breast cancer have the BRCA gene mutation, which will, if BRCA1 would say that you have a 70% risk of having cancer in your breast before age 70, and not only breast cancer, but also an increased risk of ovarian cancer. So that's why it is important to know your history, and that's why we as a community and people have to come together and be able to have a normalized conversation. I had a young 36-year-old in my office, woman in my office today, who said her mom even went through an entire, even mastectomy, meaning a removal of your entire breast. And she didn't even tell her daughter. And now her daughter's 36-year-old, just had her first child, and it comes to me for evaluation of an abnormal mammogram. And I said, so this is the very situation that we don't want in our community. We want to normalize this conversation. So people women aren't afraid to go and have a mammogram. They're not afraid about the conversations about the need for biopsy, meaning sampling the breast tissue, or the subsequent surgery, because you don't have to have a full removal of your breast when cancers are found early. You can partner in the conversation and keep your breast and only have part of the breast removed, meaning the cancer and the lymph nodes under your arm. And so it can really help allay all of the mental anguish. And that's why I was glad Jada was on the conversation, because you're never too young to be able to start normalizing these conversations. And that's what's necessary for us as a people, to come together and to have those difficult conversations.
Thank you for that. I want to ask two questions. One, why is it so difficult in the African American household or community, why is it so difficult for us to sit down and have those talks with our family members in regards to breast cancer? You know, hey, I was diagnosed with breast cancer. I need you to understand, and I need you to know that it's this form, you know, of breast cancer, and this is what I'm doing as far as my treatments, and on that road to, a cure. And also the second part of that, Dr. Evans or Dr. Edwards, you guys can answer that question. And then Jada, I wanted to go to you after that, as far as the mental component of breast cancer and what it does to our mental health. So anyone can take that question as far as why is it such a secret in the African American culture or family that we don't have those conversations with our family members?
Well, I'm not going to take it from the medical side. I'll let Steve do that. I'm just taking it from the family side. We just realize as Black females and as Black families, what's in the household stays in the household. You just don't tell secrets. One of the things I found out when I had breast cancer, that it was all throughout my family, but no one was talking about it. It was like I started telling people I had it, and like my cousins started having it, my aunts had it, my mother, well, I knew my mother, but I hadn't known, and my great aunts had it, but no one had said anything. And especially when you were younger, older people had cancer, but we didn't even, I don't even know we were allowed to say the word cancer for older generations. All we knew is that if you cut them open, they would die. That's all we ever heard. That don't get it operated on because you will die. The air gets to it. So I mean, you had such myths going throughout the family, and so now it is so important that we talk about this, as you were saying, because it is important so that you can tell your daughters and your other family members. But people hide stuff. It's our culture. It's really in our culture, and we have to try, as Dr. Evans was saying, we really need to try to normalize that.
I mean, my male breast cancer patient who was diagnosed during January and operated on during March for during the COVID-19 situation, his wife passed 2 years ago, and who had gone through chemotherapy. He required chemotherapy because it was a late stage diagnosis, stage 3, required radiation therapy. He developed swelling of his arm, which is called lymphedema, and he had all of these issues. He was a diabetic. He ended up having his toe amputated during the process. He had bleeding into his eye. He had every untoward event you can imagine, and he was going through all of it by himself. And I said, have you by chance shared this with your 2 sons? And his answer was resolutely no. It's mind blowing to hear that, and sad, because where is his support? He was there to be his caretaker for his wife, and here he is, a 60-year-old young man, alone going through the journey. So he had me, he had our cancer care navigator to help him through, but we don't have to go through this journey alone. And he says, Doc, I just dealt with it that way. In saying the word cancer for him was a defeat. And I really hope that we can change that. But as he was walking out the door, I did have hope, because he says, I've learned through this experience that in the future, when fear comes knocking, I'll let faith answer the door.
Amen. Amen. Wow. Wow. Yeah, so thank you both for that, sharing those stories. And I'm just hoping that, what we take away from this is to have those difficult conversations, because in the long run, it's going to help us, it's going to help our family members, to go for screenings a little bit earlier, so we can, possibly catch whatever cancer it is, breast cancer, colorectal cancer, just go for those screenings, because they're important and they definitely can save your life. So thank you for that. I want to move on to, because this is definitely, important, as well as the mental component of, breast cancer, especially in this pandemic that we're going through, COVID-19. Many people are feeling isolated. They feel like they don't have that support. They just feel like they're alone. So I'm going to now turn it over to you, Jada. What can we do for our mental state of mind to keep ourselves sane during this time? So
one thing I really want to stress is to really reach out to those support systems, because what you'll find, as the doctor just recently mentioned, individuals who are going through this battle alone tend to develop mental health disorders. Now, on top of the cancer, now you're struggling with depression. I can't stress enough how important it is to reach out to your supports, because what you may find out is having that additional support can help just a little bit, and it's possible to avoid having that depression by having a support system, having a team in place. Just as a personal story, having a father who was a survivor of cancer, he didn't want to tell us. He wanted to keep it to himself, because he knew that he was strong enough that he would beat it. But what he claimed to found out is, having a support team of daughters and helping him through it actually, in my opinion, helped his recovery faster. So just reach out to your supports, if I can't say anything else.
Well, thank you for that. We do have a question from our Zoom chat group, and the question is from the audience. It says, does lifestyle or environmental factors contribute to the onset of breast cancer? If so, please explain. Anyone can take that question.
Yes, we do know that there are certain modifiable risk factors for breast cancer that we are empowered to change. We know that if we exercise 30 minutes a day, that serves to enhance our immune system. And if we maintain a weight that is relatively healthy, that will also help in our recovery and also with our immune system. So those are specifically the only, and also drinking less than 2 drinks of alcohol a day also can impact our outcomes and make better outcomes if those issues are controlled.
Okay. All right. Well, thank you for that, sharing that. I was trying to see if there was some more questions. I do have one here. As far as, I'm going to kind of segue over to the healthcare systems. How are healthcare systems, better preparing for the surge of COVID-19 cases due to the change in the season? So as far as like breast cancer, patients going to get screening or to get their treatments or to get surgeries, how are the healthcare systems preparing those patients and making them safe in doing that?
Well, like I said, I just had my mammogram, probably less than a month ago. I have to say, they're taking all the precautions. I mean, they're definitely doing physical distancing in the waiting rooms. You can't. It's sad, but you can't have people come with you as you're going for these tests now. As before, you would go in and out of dressing rooms to dress. They're having you do all your dressing in the room with the mammogram. You watch them wipe everything down. Everything is clean. Everybody's wearing a mask. So, as far as getting your mammograms, they are keeping the areas very clean and very safe. I actually think the hospitals probably are safer now than they were before. Really, I think they are really sterilizing and cleaning everything. So I think, they are prepared there. And then I'll be honest, I just went through a procedure and had to stay overnight. And again, all the staff was very conscious of making sure everything was clean, sanitized, wearing their masks. I never saw anybody without a mask. They coming in and out of the room. They encourage you to stay in your room. I know that's a little more difficult because usually you're used to getting up and walking the halls, but they're encouraging people to stay in their room so that, again, you're staying away from people if you don't have to, So, I think the hospitals actually have taken all the precautions that they possibly can. I always think the hospitals were safe before this, but I would actually say now that the hospitals are probably safer than they were prior to this going on.
Okay. Thank you, Dr. Edwards. Yolanda, moving on to you as a survivor. Can we talk about the relationship between the patient and the survivor and the patient and the provider? Let's talk about that. How did you feel with your provider? Were you comfortable with him or her? Did you feel like they, gave it to you on your level in which you could understand? Because sometimes, our providers, they kind of talk over here and, we leave the office and we're just kind of like, what did he just say to me? All I heard was breast cancer. Mm-hmm. So can you speak a little bit about that for us, please?
Sure. So I'm going to speak from kind of two different perspectives. One, as a survivor, unfortunately, my aunt, who is fine now, was also diagnosed with breast cancer 2 years before me. So my path to treatment was already selected. I already knew which medical oncologist I was going to have, surgical oncologist, and I kind of followed in her footsteps. Because of those relationships she had already built, I kind of knew what to expect because my mom was her support while she went through, and my mom was also my support. Unfortunately, within a 2-year time span, they saw her all the time. So they knew, what level of care we expected. My aunt used to be an administrator at Children's when it was still in Oakland. So they knew what to expect and they knew, how we needed to be treated. So from that perspective, I already had history, for lack of a better phrase. So that was not an issue. I will say, however, on the other flip side, now that my active treatment is done and all of those things are over, I have a radiation oncologist that my aunt did not have. I have some other doctors now that she did not have. And I will say there are some times, contingent upon how strongly you self-advocate or not, they do talk over you. And I think as doctors, and no offense, doctors here, sometimes they're just doctors. That's what they're trained to be. They are trained to keep you healthy, to keep you strong, for you to live. And that's what they're doing. But as a patient, sometimes we don't know how to process everything that they give us. But that's why I said it's really up to you to self-advocate, to educate yourself as much as possible. If there's something you don't understand, or if there's questions that you have, ask, because that's the only way you're going to get your answers. So from the other side of the perspective, yes, I've been in rooms where I'm like, okay, he does know I don't know what that means, right? But then that was on me to find out what it meant, or to ask, and not leave the room until I got every answer I needed.
Okay.
And Yolanda, then how then has the National Breast Cancer Coalition helped you become not only a survivor, but a forceful advocate for survivors of breast cancer?
Oh, good question, Dr. Evans. So I've done, in probably the 3 years since being done with active treatment, I've done numerous trainings. I wanted to be the super advocate, and one of them that Dr. Evans is talking about through the National Breast Cancer Coalition is their scientific course called Project Lead, where literally they teach you in 1 week from the very beginning of how cells are formed up until the different types of breast cancer, what they mean. They brought in scientists and researchers, and we learned from the best. I can definitely say, starting the journey, being this bright-eyed, bushy-tailed 36-year-old walking around with a disease I only thought my grandmother got, scared of my own mortality, to now walking through this journey, now working for kind of a hybrid of Hillman and McGee and University of Pittsburgh as a researcher and clinical trial ambassador for breast cancer, to going to Project Lead. It's definitely empowered me to empower others. Not only as I learned, I also gave to my community. I also went back to all of my other organizations that I'm a part of, specifically the African American community, letting us know what needs to be done, what's newly on the horizon, what medicines or what treatments are out there. So it's definitely equipped me to be an even better survivor, if nothing else.
Wow.
You know, I also want to say, you know, Yolanda, you would say we're physicians, but you know what? When you're ill, when you got an illness, it don't matter whether you're a doctor, it don't matter what you are. You still need an advocate. You
Yes.
need somebody by your side, because as you said, Tiana, the only thing you hear is, I have breast cancer. And after that, your brain totally shuts down. It does. It just shuts down. You don't know what, I'm sitting there, I'm a physician. I didn't know what questions to ask. I didn't know, I mean, I know what the treatments are, but I didn't know how to, nothing. I'm telling you, nothing goes through your head. We need advocates. I don't care what you do. You need someone beside you who can ask those questions for you, who can remember the answers. Even if you ask the questions, you probably don't even remember the answers. You walk home and people say, what did they say? And you're sitting there going, I don't know. So, you know, it doesn't matter what you do.
Mhm.
Doctors still can talk over your head, or you just don't hear, or, you know, you just don't remember, one of the three things. But you should always try to have someone with you, someone else who can talk to you, someone who can remember what's going on. Never, again, we was talking about, never try to go through this journey alone.
Absolutely.
It's not necessary.
Absolutely. And there's actually an app for that now, Dr. Edwards, just so you know.
Okay. But always take somebody with you.
Absolutely.
I think too, just being a nurse as well, we also could be advocates for breast cancer, you know, patients as well, by doing what I call the teach back, you know, method. I always, you know, when I'm discharging my patients, I'm always asking, okay, what did we just discuss? You know, I want you to tell me what we talked about. What does that mean to you exactly? So that I feel comfortable knowing that they're going home, you know, to their own environment, and they can care for themselves. You know, they know exactly, you know, what to do. Of course, you know, when you get home, you know, oh, I forgot the one thing that she told me to do. You know, we give them phone numbers and things like that for resources so they can call and ask those questions. But for the most part, I, as your nurse, want to make sure that you left knowing exactly what you need to know in regards to your care. And I think that that would definitely be helpful as far as, that patient provider relationship, just to kind of do that teach back, method with your patient to make sure that they kind of understand something. And like you said, before, Dr. Edwards, to have, somebody maybe there with you. I don't know as far as the hospital policy and procedure, if you're allowed to have somebody there in the office with you because of COVID, but I know definitely that will be helpful, or to have them on FaceTime, or, have them on the phone while the, provider is having that discussion, that difficult discussion with the patient, so you can have somebody advocating for you if you can't do it for yourself.
And take your summary home. A lot of people don't want to take their
Yes.
summaries, but take them home.
Mhm.
You'll read them later on and say, oh, that's what they said. So take them.
Right.
I think it's important to engage in, like you said, Tiana, it's called active listening. And as a part of the reverse side of that, I want to know if my patients are actively listening to me. So it's my responsibility as their provider of care to not talk above their head, and to make sure that before they leave that session with me,
Uh-huh.
if the diagnosis is breast cancer, they can tell me what stage breast cancer they have, and they can tell me what size tumor they have, whether if they've had surgery, what the pathology shows, because I go over that in detail, and what that means, their hormonal status, and what additional treatment is necessary. So I feel with that, having the patient do the summary, that's my only reassurance that they really comprehend and they are present in the moment, without and are no longer just overwhelmed with hearing the word cancer, if they can perform that feedback, give that feedback to me. There was a question about clinical trials. In our community of people and the history of syphilis and the Tuskegee experiments, we know that as a people, I mean, we've been experimented upon in many different ways beyond, our consent, and so yes, there has a history of mistrust. But I need to tell you with no uncertain terms that in this day and age, we are really committed. If we are having a conversation with you about engaging in a clinical trial, it is really for us to give you not only the best standard of care at the time, but we're questioning whether a additional medication will add benefit to what we already know. So the clinical trials are really to your advantage as a participant. And you're, just as Dr. Evans says, you're talking about being given oversight. You are followed in more ways than you want, with more tests, and for many years beyond the end of the study. And so I'm sure Yolanda can even speak to that even more, as she tries to encourage women to participate in clinical trials, so that we can gain more knowledge, because it's only in a standardized clinical trial can we gain more information, so that future women diagnosed with breast cancer can benefit.
Absolutely, Dr. Evans. It's much of what you said. It's historical, it is generational, the mistrust that our community has around clinical trials. So a lot of things that I do in my role as a clinical trial ambassador is to ask where people are in their own thinking, in their own beliefs in regards to them, because 9 times out of 10, it's a myth. We're not treated as guinea pigs. You're given the standard of care. At the end of the day, just like Dr. Evans noted, it's actually usually something they want to add to see if it'll also work. But let's take into consideration, historically, most clinical trials were done on white men. So a lot of the medicine that we are having in the world, I don't know if it's going to work on me. My name is not Adam. I'm not white. So just like Dr. Evans noted, it's really for our well benefit that we enroll, that we educate ourselves around them, because that's how they're going to know how how it's going to react to us specifically. African-American enrollment is very low for clinical trials, lower than I expected it to be. But I mean, we have to take into consideration those things in our community that aren't discussed. Like Dr. Evans noted, earlier, that we have to normalize these conversations around it so that we know how beneficial it is. I'm on tamoxifen right now. It came about because of a clinical trial. And if that didn't work, I don't know where I would be. So they're definitely important for our community.
Yes, they are. They definitely are. Thanks for sharing that, the two of you. That's definitely, very important to know as far as the clinical trials. Wow. What about as far as like clinical trials and, the treatments and things like that? Should people go the modern medicine route, or should they go the holistic, route? How would one decide what treatment would be good for them? Can anyone answer that question?
I mean, speaking from a survivor's perspective, I
Mhm.
have a couple different thoughts on that. I honestly believe your journey is your journey, and what you choose to do, you always have to choose what you think is best for you. Like I said, I knew what doctors I was going to go to for my journey, but my aunt was in her 60s when she was diagnosed. I was 36. Post and premenopausal was two completely different paths. So that part of my journey was my own. I went to all the doctors. I listened to what they said. I did my own research, and I took into consideration what was best for me. Like Dr. Evans noted earlier, technology nowadays is amazing. I didn't have to get a mastectomy. I just got a lumpectomy, which he said is just like taking out the tumor and preserving your breast. That's what I chose, but I have friends that chose something altogether different. I can't really speak to the like holistic because I believe in science. I believe in that God gave us medicine for a reason. And I believe that he created doctors like a Dr. Edwards and a Dr. Evans to save people like me. And I trust their judgment. You know what I mean? That again, though, that's my journey. Again, I know someone who went the holistic route and she's in cryo tanks, and that's her journey. I wouldn't have picked that for myself, however. So I think it's very personal, how you choose and decide what you choose to do after your diagnosis.
Okay. Thank you
Just
for
like
that.
like Yolanda said, it is important for each person to be in control of the path that they choose to take. At the UPMC Hillman Cancer Center, we really do encourage a whole person approach, just like Dr. Edwards said regarding even Gateway at Medical Health does. So we would like for the persons like Jada to participate in the process early, and we so that Jada could even influence talking about how to de-stress, and because talking about how to de-stress, whether that be through yoga or mindfulness, that impacts your immune system and also your outcomes. So as an integrated medicine approach, we encourage those things. Acupuncture is a known effective tool in some women who have difficulty with nausea and vomiting and side effects of chemotherapy. So we do try to integrate those things that we know are effective by study and past experiences, as opposed to using anecdote. We really do try to impart the best practices in our treatment plan.
Okay. Thank you for that. Jada, can you kind of tap into from the mental perspective, if you had a patient that, came into you, wanting just to kind of talk about, newly diagnosed with breast cancer, can you speak a little bit about the treatment that you would give that patient and how to cope with being newly diagnosed with breast cancer?
Sure. So coming in, if I do have a client who was recently diagnosed, I would just typically ask, kind of what brings you in, because maybe necessarily it's not even the cancer diagnosis that they're even coming in for. However, let's just say it is. I leave that space for them to talk about whatever they want to talk about in relation to the diagnosis, because what I often find in therapy is they don't have anyone to talk to. Everyone's exhausted from hearing about my diagnosis. They're tired. It's kind of old to them now, where it's still fresh to the individual. So a lot of the work that I do with them would be just kind of listening and then talking about, okay, filling out, seeing what the symptoms are, if they're presenting any symptoms of depression. Typically coming in, a disorder for somebody who is diagnosed with cancer will be an adjustment disorder, because it's an adjustment period. So complete change in their entire life. However, we look at something sort of as like depression when past 6 months. I'm looking at time frame. I'm looking at how these symptoms have affected your daily living. Are you no longer showering? Are you no longer eating? Anything that is outside of kind of after they're visiting their doctor and they're understanding, okay, they have these symptoms from chemo and different things like that. But if the symptoms aren't due to any type of medical treatment, now we're looking at the mental health. Okay, is this actually depression now? So if this is, let's talk about what can we do to get you to shower today? What can we do to get you to at least eat one healthy meal, or talking about just taking a walk? So after all the medical is kind of ruled out, I look at the additional symptoms and then go from there in regards to treatment. So just really meeting them where they are, and just taking it step by step with them. All of my clients, their treatment is tailored differently. My treatment is not just all across the board. It's not linear, it's very fluid. And just whatever the presenting problem is, I take that, I listen, and then we kind of roll, and then we craft a treatment plan and we go from there.
Thank you for that. What's psychotherapy? Is that something that you would use?
Yeah, so psychotherapy, yeah, it's really therapy treating any sort of mood or mental disorder. Typically, I treat like anxiety, depression, bipolar personality disorders. But a psychotherapist can treat anywhere from that to, schizophrenia, any sort of mental health condition. Typically, psychotherapists would treat.
Okay. Well, thank you definitely for that. This has been very, very informative. I know we are down to like 10 minutes. Is there anything else from a survivor's perspective, medical perspective, mental perspective that anyone would like to share?
I'd just like to also add that, especially during this COVID-19 season, where people have been isolated, like you said, believe it or not, fewer people, of course, have had access to routine screening. So unfortunately, it is anticipated that we will have as much, almost even a 20% increase in breast cancer and all cancer diagnoses. And especially if that is the case, we have to be aware that our communities, Black and Brown communities, are the most adversely affected by that reality. So I would encourage our listeners to really re-engage with the healthcare system, and to know that we are doing everything to keep you safe, as well as keep ourselves well and healthy, so that we can care for you. So please go and get your screening, be it a mammogram, be it a pap smear, all kinds of screening. There's screening that are available for early lung cancer through low dose CT scan of the lungs. So then go and see your doctors and talk about prostate health and the risk of prostate cancer. Because like I said, if you have a mother who had breast cancer, like I have my mother and my sister with breast cancer, the concern raised with me, well, am I at risk of also having breast cancer, prostate cancer at an earlier age? So know your history and do what you can to empower yourself to determine how your story ends.
We have two questions. One is, how do we set up a telemedicine appointment, Jada?
In regards to mental health. So typically all you have to do is just ask your clinician, just say, do you offer telehealth appointments? And typically you'll go through a portal. My agency, we use, I believe, Splash now. So just talk to your therapist and they can easily set you up with a telehealth appointment. Typically now I'm only doing telehealth right now just because of COVID, but just talk to your therapist and they can set you up with a telemedicine appointment.
Okay, thank you. How do we go about getting, if we don't have health insurance? And let's say we were recently diagnosed with breast cancer. How do we go about the financial assistance, with paying for medical bills? Because I'm sure it's expensive with the treatments and medication and things like that. How do we get that financial assistance?
In the state of Pennsylvania, with the Healthy Women's Project, which has a long fancy name now, anyone can get the application secured, and we do that through our preventative health division. Lynn Robinson is at our institution, and Cece Williams can help facilitate that, and Betty Dowdy can help facilitate that at our Hillman Cancer Center, where that would enable you not only to get your diagnostic studies, but also your surgical and medical treatments, and help facilitate your applications for Medicaid or Medicare or whatever those needs are. And you raise another point. It's not only being uninsured that affects the poor outcome, but we really do need to have our community foundations consider providing grants to even our medical societies, such as Gateway Medical Society, or some vehicle through which the patients can have their copays and even helped assist with. So just having a conversation, even with my financial planner, I was able to get extra monies and funds to a patient of need. And had I not had that conversation, that would have never happened. He received a check for $1,250 this week. So like I said, we have to just open the conversation. And there are many people out there and foundations out there that are willing to help. We just have to know about them and submit grant proposals to make that a reality.
Okay, thank you for that, Dr. Evans. Yolanda, where do we go to get our support? The support groups, I know there's support out there, not only for the patients, but also the caregivers. Where do we go to find that help?
Absolutely. So me personally, I facilitate a young adult African-American support group of any cancer. It was just launched under the Young Adult Survivors United umbrella, I think in August. It's been going really well. So if you know of anyone that's under the age of 40, 45, that has been diagnosed with any type of cancer that needs support, everything is virtual right now. Definitely feel free to attend. I also am connected with Dr. Evans in the McKeesport area with our support there. Last meeting was amazing, Dr. Evans, by the way. But there's great support, spiritual, all connected to the UPMC McKeesport area. So there's support there. You can reach out to either myself or Dr. Evans if you're in that area as well. But I do believe everything right now is virtual as well. So that can still be done online. But depending upon where you are in your walk, I know some people aren't ready to talk about it in a group setting. I do know that at the Cancer Caring Center, they have an African-American breast cancer support group, but they also have a counselor on hand. So if you find, you just don't feel comfortable just yet, either seeking out your own personal therapist or you're not comfortable with a group setting, I know they have free counseling going on also virtually there as well. And depending upon what you're looking for, I mean, there's online blogs and support groups on Facebook, depending upon what you're looking for, that you can definitely reach out. One of them is for the Breast of Us. They have a whole breast cancer movement just for women of color. There's the Sisters Network that's also online. So there's a couple different avenues you can go down depending upon what you're looking for, what kind of support you're looking for.
Okay. Well, thank you all for joining us tonight, our panel of experts. our viewers, we just want to thank everybody for joining us. It was definitely informative. So much information that we've shared this evening. We're just going to leave you guys with, make sure that you go and get your screenings for breast cancer, you know, any type of screening that you need to. Make sure you set up an appointment with your provider, get in there to see them. They have made it safe, you know, for you to go and actually see your provider. Just make sure you're wearing your mask, you have your hand sanitizer, and you're washing your hands. It's definitely important that we continue to take care of ourselves, especially in this COVID pandemic. So I just want to thank you guys for joining us and, you know, giving us the information that we received tonight. Thank our viewers for the questions that you guys have given us. And we hope that we answered all of your questions. And guys, just stay safe. Just stay safe and stay healthy. So thank you guys for joining us, and good night.